Hello, everyone, and welcome to our Casa de la Familia monthly therapist roundtable. Each month, we will talk about different topics that are affecting our communities and our mental health. This month, we will be talking about the stigma that surrounds seeing a therapist and working on our own mental health.
Hi, I am so happy to be here today. But before we talk about what it's like to go to a therapist, I would like to ask all of you maybe what has been a difficult just situation or just difficult about your culture, about your upbringing when hearing about a therapist, or maybe, growing up, we never really heard about therapy. So I would love to hear from you first.
Well, in my culture, my family is from Mexico. My parents are both from Mexico. The majority of my family um, is from there. And I never really hear them say therapist. It's always psychologist. So even when I tell them like, "Oh, I'm a therapist," they're like a therapist, like physical therapist. I'm like, no, I'm a therapist. And then I explain to them like mental health, and they're like, oh, a psychologist. And I'm like, okay, yeah, that's fine, totally psychologist. And so the majority of my family talks about it, but yet no one was willing to go to a therapist or a psychologist because of, just the stigma of like, oh, you're crazy. If you go to a psychologist, you're crazy. And I go to Mexico a lot, and I have a family member there who, has psychosis. And my uncle, when he was explaining to me what was going on with her, he even said it in like a low tone. And we were in public, like people probably couldn't hear us, but he said it in such a low tone. And, I asked him, and he's like, well, I mean, I don't want people to think she's crazy. And and I had to get to talk to him and explain to him like, no, she's not crazy. And it's just really sad because we see so many people struggling mentally, with just so much depression, anxiety, and not getting the help they need because they're afraid of it, at least in my culture.
Similar to what Gabriela was saying earlier, they always consider therapists as psicólogos, which is psychologists, all the time. So that is a common term that they do use. So because again, they generalize the fact that it's psychology, and in Spanish it says psicología. They always identify people who work in the field as psicólogos to reference psychologists. So I know it's challenging trying to explain the different the different titles for different positions, but yeah, I mean, again, I think that the tide is changing, which is good. I mean, I think we see it a little bit in our own professions right now. A lot of our community coming to seek some kind of assistance, but there still is that negative stigma, I think, there of being reluctant to still admit you need help. And I think when you're really in it, they're scared to really say what's wrong with them. And I think that's also, a challenge for us in the field of really being able to help them fully if they themselves aren't, wholeheartedly honest with us and what they feel, what they're dealing with.
From what just David and Gabriella were saying, and similar to my culture, my parents were from Southeast Asia. So me telling them that, I'm going into being a therapist, it was like kind of a shock for them, they're like, why? And it's just interesting because growing up, emotions weren't something that you expressed. It was something you dealt with internally, and being able to show emotion or be sad or it was a sign of weakness. Being depressed was a sign of weakness. And so within our culture, it was like whatever happens in the home stays in the home, and you don't talk to other people about it. You kind of keep it to yourself. And, it was growing up, it was often like that. Like you share only within your immediate family, and no one else needs to know what's going on in your life. And so it's hard to kind of break those generational influences that was passed down. And so with my family, it's about educating, right? And also, like you said, like how for us, it's like when they look at mental health, they think of psychosis or, extreme ends of mental illness, rather than depression or anxiety, right? And also when talking to people within my culture, they seem to separate those things as emotion versus physical reactions instead of seeing them as a combination of both.
I could definitely understand where all of you guys come from. I also come from the Latino background. I was born and raised in Colombia, and my family from my dad's side, they're very European, still very ignorant to the idea of receiving mental health. I remember as a child having to go to therapy, and it was a taboo. Nobody in the family talked about it, because I was acting out and I was having some personal issues, and that kind of put me in a category in the family of a problem child. It wasn't something that it was talked about. It wasn't something that was discussed as a family. So I was very isolated to a certain extent in that aspect. And I myself had to deal with that somewhat on my own, so far to a point of getting myself fired by my own therapist. Something happened and she pissed me off, and I was like, I'm gonna get back to this lady, because that way I won't have to come back. And my family was okay with it. So that goes to tell you how much knowledge we lack of the process of having a child need assistance, having a child be supportive to a child's needs when it comes to mental health services. And I think it's super important. I think most of our programs in the process of getting our master's required us to have therapy. And I think it was wonderful. And I was very thankful for that, because it kind of pushed me to, like, you know what, I need to get out there. There's a lot of stuff that I need to work on, and I acknowledge that. But that was like my opportunity to say, you know what, I'm gonna nip it in the bud. This is the perfect time to just go out and do something about it, compared to just going on my own. And still, as I was going to school and getting my bachelor's in psychology, and then your master's is a completely different beast. It's something that you're going to be doing for the rest of your life. It's not something that, I could go on a weekend and just earn something as a certificate. It's something that I'm going to be, dedicating my life to. And I think this process was so important that helped me realize a lot of stuff. Like some other people, sometimes realize, like, you know what, this is not what I want to do. Maybe I got the education and I got the degree, but it's not something that I'm good at. And respects to that. I respect all people that either fall into it or fall out of it. But I think it's important for us as a community to learn a little more about it, to get our feet wet and read up on what is therapy, what is psychology, what are the different positions and professions in the branch of the tree of psychology. Because there's a lot. There's psychiatrists, there's psychologists, there's mental health therapists, there's counselors, there's social workers, and we all are here to help. But each of us have a certain aspect of what we do that we are good at, and we kind of focus on and we emphasize on. So yeah, I think it was hard. It was hard growing up, and it continues to be hard. That's like we talk to our families and try to educate them on, this is my first time. They're probably 45, 50-year-olds, and they never understood the concept of what it is to be in therapy. Oh my God, talk about mind stuff.
Yeah. And just
I don't even know you.
True. And I like how you brought up an important point, Diego, the self-sabotage. I think that's also something that's very common as well, I think, in a lot of in some of our cases, because like you said, it is a challenge to really, pour your whole heart out, like they say, or your soul out to someone who you don't know, or, they touch upon something that maybe you try to avoid for so long, and you're always trying to find an escape, and I think that's a challenge, I think, for all of us here, sometimes to be able to read, the body language, of what they feel or what they're sensing in that moment where you're discussing certain topics, to hopefully avoid, like what you said, Diego, of self-sabotage, say something or do something that might get them kicked out. But I think that's something important for everyone to know, is that, it's not our intention to cause any more pain. We are here to try to help, and the only way we're able to do so is we need to sometimes ask, I think, those difficult questions, or, sometimes some of our clients or patients, feed us those breadcrumbs, and it's up to us to kind of follow that trail, to the bigger chunks as we get, as we go along in the treatment. And like I said, again, just know, it's not our purpose to cause you more pain. We are here on this, on this travel or voyage together. That's the way I like to take it with my clients. I always like to use the term we, because we are in this together. They're actually inviting us to be a part of that life, or that part of their life where they're, trying to change, trying to make things different for themselves. And, it's something important, I think. I think we all take into consideration, when we meet with our clients in that one-to-one type of environment, that, we're going to encounter these things together. And hopefully we have the tools to, help you, get over this troubled time or this troubled episode in your life. And what we really want to do is just help you move forward. And I think anyone who comes to therapy first has already taken multiple steps, I think, to bettering themselves. First, of course, is acknowledging the fact that, hey, you know what, this is something I can't control. And two is like, I think I might need help. You're already taking those two steps, and then just seeking someone out, and then finally making that call. It's a process, but just know that you're already on that right path. And even though you may have stopped somewhere along before you actually meet someone in person, I think that's okay still, but at least you started and you acknowledge. I think that's very important, and which a lot of people don't give themselves credit for. I don't know what any of you guys think. If you guys maybe come across a client, I know I have, when they said, it took me a couple of times, to finally make it in here. And then it's like, I just praised them so much and said, you know what, let's not worry about how long it took you to get here. The important thing is, like, hey, you are here, and good for you.
Yeah, definitely. I have had a few clients like that, but then I think that's why I always try to, make some time to talk to them about their experience, coming to therapy, what it's like for them to be in therapy, and, what their fears were, what their concerns were as well. Because, myself, I know what it's like. I know what it's like to come from a culture that tells me that because I'm in therapy, there's something wrong with me. And, and they say that too, like, something must be wrong with me because I'm here. And, knowing what it's like to, go to therapy as a child, and the family kind of hide it. It's almost like a secret, right? Like the family secret, that you're in therapy. We can't tell anyone. So I like to just, like David said, just point that out, how strong it is to actually ask for help, because not a lot of people are doing it in their family or in their culture. And it is a strength to do, to say, hey, like, I need help. I'm struggling a bit. And it's not that, you're crazy or that you're the problem, but that, you just need a push, like any other human being that has feelings.
I think I'm going to jump into what Gabriela was saying about, I think, the importance of therapy, and I see it as a vehicle. We all drive, and at least I hope, and we know what it's like to maintain a car. You don't only go to the mechanic when your car is broken down, right? We have to go do oil changes and change the filters and whatnot. So that's how I see our mental health. We need to do maintenance. We need to continue taking care of it, so it lasts a long time, just as our bodies. We got to eat healthy, we got to sleep well, we got to exercise, we got to be active. But if we talk to someone, let's not wait until we're completely broken down at the bottom of the ocean, drowning, feeling like we're alone and devastated and crying every day. When something feels not right, just like your car, if your car starts to stumble a little bit, you're going to go get that checked. Don't wait until your body starts to stumble mentally or psychologically for you to go find help. If you see something is going on, something isn't fitting or feeling the way you used to, per se, take care of yourself. Seek for the help. And that's what we're here for. I think this is a very accepting career, because you have to be accepting of yourself to be able to help others, as well as accepting of others to be able to help them in that process. So I guess this could be an invitation for everyone to maybe go down that checklist and evaluate yourselves and see where you're at. And don't wait until you're completely down or completely depressed or completely sad about X, Y, or Z to seek for help. You know, if there's something like that you've been carrying on, and that I call it the backpack of rocks that you've collected throughout your life. You know, it's okay to take those rocks every now and then and take them out of your backpack, because it does get heavy. It does get exhausting carrying that around. So take care of yourselves. Take care of your well-being.
Yeah, I really like that analogy, Diego, of the maintenance. You know, you're right. You're right, man. You know, I know it's definitely a challenge to get those quarterly checkups. You know, even for yourself. I mean, even me myself. Even going back to the analogy you just used. You know, not every mechanic's gonna be right, or you don't feel right with it. Same with therapy. I think, you know, you have a choice. You know, of see who fits well based on what you need in that moment. You know, I myself, I'm in therapy, you know, and have done so for so many years. And in, you know, my own experience, I know it just, you know, it took me some time to find the right one for what I was dealing with in that moment. You know, and I know currently right now, I think I found the right mechanic, to use Diego's analogy, you know, and I'm keeping up with that maintenance, you know, which is my mental health, you know, which is very, very important. I know, you know, it's definitely interesting sitting in the same room, right, with someone else who's, you know, in the same profession as yourself. But at the same time, I just think it's just mind blowing. I mean, at least for me, you know, seeing the techniques they use, you know, and you making yourself vulnerable. You know, now you know, we kind of switched that role now. You know, we're sometimes so, you know, busy, you know, trying to help others, that we tend to forget about ourselves at times, and it feels good. It feels good, you know, finally being able to say, you know what, I need to be taken care of. You know, or going back to, I love that backpack with rocks, you know, like, hey, this backpack is definitely getting heavy. So when I go see my therapist, it's like, can you help me for a bit, you know, hold on to it just for this little while, and see what we can deal without, you know. And it's definitely a relief. I think, me personally, when I leave those sessions, you know, it's just like, it's just less weight, you know, on me, on my shoulders, you know, in my heart, in my soul, in my mind. And again, just knowing that, you know, my therapist is there for me, and whatever I need to discuss, he's gonna keep it for himself. And it's just awesome to, even though every 2 weeks I go, we pick up right where I left off, or just that simple check-in, you know, say, hey, you know, last time we discussed this. And I think, me myself, I take that into my own sessions as well, you know, some of his approach, because it makes me feel so comfortable. You know, we discuss, like, if it was just a person-to-person conversation, which that's what it is. Overall, I know a lot of us, going back to the stigma, you know, we may see in cartoons or movies where it's the couch therapy. You know, oh my gosh, I'm gonna lay down, and, you know, my therapist is gonna be sitting to the side of me with a notepad taking notes. You know, and it doesn't have to be that way. You know, at least for me, it hasn't been that way. And I try to do the same for the people that I service. Is we're gonna sit down, and I sit with them on an equal level and have that conversation, you know, which is to see where they're at. I don't know how it is for all of you here.
Well, I want to jump in because I did like what Diego, that analogy too, and just that invitation for those of you that are seeing us. And like David was saying, just because of that stigma, I'm also you know, a therapist that has been to therapy. And, you know, it was a difficult decision, because when you grow up there, it's true, you have no room to share, because everything is so fast, because dad's working, mom's working. So there's no place to sit and actually talk about how you feel. And not only that, but sometimes, as a lot of you were mentioning, it's like, you're sad, you're feeling that, just get the broom and start sweeping. Like, it'll go away if you do that, right? Or like, do this and it'll go away. And you're like, are you serious? Like, I'm being vulnerable. So then they teach you how to stop being vulnerable. They teach you, like, you don't want to do that anymore. And then another thing that kept that actually David, when you were saying, I know that my therapist is gonna keep it to himself. Growing up, when you talked about therapy, it's that fear of, well, if you tell your therapist this, like he might like send social services, or all these things, like, oh, they might say we're crazier. And it's like, wait, but going to therapy is crazy, but then you're saying that our family is crazy. So it's all contradicting. So I just want to share my experience too, because before I did come into this profession and got all this training, to a certain point, you kind of believe what you're told, right? That like you learn that, okay, maybe going to a therapist is something for crazy people. So you grow up with those fears of, what if I do this, right? The disapproval of the family. But going to therapy was one of the best experiences I had. And going to therapy, you don't have to be facing depression, anxiety. You don't have to, like, you can just, like, you could be grieving. You could be going through a loss. You could be going through a change in your life. And just sitting in front of a therapist, like as a clinician, I understood what my client feels when he or she is in front of me. I was nervous. I was scared. I was thinking, like, what is this? Is he thinking I'm crazy? Is he thinking I'm too anxious? Is he thinking, something's wrong? But then when you're sitting there and you just, you just ask those questions, it's really helpful. Like, what approaches are you going to use? How can I be okay with therapy? How can I learn from you? And those are the type of questions that I asked my therapist that helped me. Have you worked with this population? Have you worked with something like a loss that I've been through? Have you, what have you seen in other clients? And again, sometimes part of you has that thing of like, I wish they could give me answers, or I wish they could tell me, this is how you need to go about it. But it also teaches us patience and compassion to our clients. So I totally agree. For those of you that are seeing us, check it out. Not every therapist is for every client. That's okay. We can always call the office. We can always be upfront and say, hey, I really wasn't feeling it. But one thing that I do know as a clinician is that sometimes us as clients, we might say this because we don't like to talk about the uncomfortable. So when your therapist asks you, you're like, oh, I hate her. I hate him. He's not even that good. She's not even that good. But it's not that. It's because we don't want to be vulnerable, and we don't want to feel all those emotions that we've been carrying and that have been hurting us for so long. So at least that's my experience, and I've loved it. And the last thing that I would say is that if we go to therapy for whatever reason and then, we feel good, it doesn't matter. Like, we could there's pauses in treatment. We don't have to go like our entire life or consistently, like, we feel good. Okay. As clinicians, we also need that space, to talk about our lives. We're not perfect. We go through certain things, and we also need coping, and we also need orientation. So I'd love to hear more of all of you, your experiences.
I definitely felt the same way going into therapy. I was like, how are my colleagues going to view me if I have to go to therapy as a therapist? But it definitely changed my life as well. I think with therapy, there can be positives too, as like maybe the good things are happening in your life and you want to share it with somebody, and therapy could be that room as well. I just remember like whenever I would have therapy sessions and I was feeling good and I was like, I don't want this to end. I want this to keep continuing. I want to gain those different perspectives of myself. And then also understanding where my clients were coming from, because I was sitting in the client chair and feeling like, oh my gosh, what is my therapist thinking about me? Like, like, am I saying too much? Am I sharing too much? And just always having those experiences validated for me was something that was truly empowering.
It was so hard for me. And it's crazy because, I always knew I wanted to go into this field, and I did therapy when I was a kid, but I honestly didn't remember a lot of it. And my mom went to therapy, but then I had to go to therapy when I was doing my master's, so I had to do it for hours. And I was like, oh my God, I know what's gonna come with this. I know I'm gonna have to talk. And I'm usually a very quiet person, so I like to listen. So I was like, man, that whole hour is gonna be about me. So now the tables have turned. So like I was going in and I was like preparing myself, and yeah, I mean, it really showed me like how it is to be a client, like one of my clients, to just sit there and, you know, even in the silent moments, just sit there and feel so anxious, like, oh my gosh, what do I say now? And, you know, sometimes, you know, as a clinician, sometimes we think like, oh, they're not talking to us, or they're not giving us more. But a lot of times, like when I did therapy, I realized that there was a lot of things that I was doing that I didn't know I was doing. There was a lot of things that I was like, whoa, like I'm not talking because it's triggering something for me. And I was doing the same thing that I was doing when I was a kid, which was just staying quiet because I couldn't share my feelings or I couldn't cry. And then I remember that one time that I cried, I was like, I couldn't stop. I was just crying the whole time. And it was just so funny afterwards. But it was definitely really hard because I had to be vulnerable. And that was something that I was used to, people being vulnerable with me as a therapist, or just being that person that people come to, but I wasn't used to doing it the other way around. So it definitely helped.
And I feel like a large part of it is like you're meeting somebody who's not within your circle. So no one who like knows anybody or anything about your life. So it's kind of like a release where you could just leave it in the room and then carry on with your life and not have to worry about the therapist showing up at your door or like meeting your family, right? And knowing all these things about you. So it's like being able to, like what Diego said, like put it down somewhere because it's so heavy to carry all the time. But giving clients that opportunity in that environment to feel safe, to put their feelings down and to unleash and express themselves in a way that they won't be judged is powerful.
I think Candace mentioned the fact that not every therapist is a fit for you. My process was ridiculously hard. I went through probably 4 or 5 therapists before I found the right one. And I was feeling guilty. I was feeling guilty of, I know, but I can make it work. Or maybe I'm just being, I don't know, difficult or whatnot. And when I finally found the right person that I feel comfortable with, sharing my personal stuff, I was like, so this is what it's supposed to feel like. And it's fine. And it's okay. Don't feel bad, don't feel guilty. That time that you with your therapist, it's all about you. Nothing to do with the therapist. That's your time. During that hour or 50 minutes or 45 minutes or whatever time, you are the boss. You're the voice. We're here to help you get through whatever it is that you're encountering that time in your life. Whatever it is that you have to let out or you have to get through. That is our job. Our job is to help you build that bridge. And I always say this to every single one of my clients. It's an 80-20 relationship. You do 80% of the job, you do 20% of the job. It's a two-way street. You go and you come. You give and you get. And that process, I promise you that you're going to learn so much about yourself. Because I did. And when I finally found the right person that I feel comfortable with, to be able to work through my stuff, I was able to get in touch with my inner self. Something that I've been suppressing for so long, since probably the age of 3, and I just didn't get a chance to explore, didn't get a chance to talk about. I think that's the important part. You know, being okay with not feeling comfortable with that person that you're currently seeing. And saying, you know what, maybe I'm gonna call the office. And we as therapists have to give that back and say, you know what, I just wanted to check in. Tell me, are you feeling comfortable? Are you okay working with a male? Or are you working with a female? Or are you okay working with who I am? You know, and if it's not, it's okay. You know, I'm not a, how do I say it? I'm not, you know, the piece of candy that everybody has to like me. You know, it's about you. And if you're not feeling okay, it's okay. I promise I won't take it personal, but I want you to feel comfortable. I want you to be okay. I want you every single week that you come to therapy, I want you to be okay with who you're sitting with and who you're willing to open up yourself to. So, I guess this goes for both clients and therapists. We have to be willing and not take it personal. If there's something wrong with us, then if we're not a right fit for a client. And it was hard to learn. It took me a while getting fired from a client. I was like, holy cow, did I make the right choice? Am I doing the right thing? Like, oh my God, I suck at this. Like, no, it has nothing to do with it. It has to do with the client. And again, if we're not the right fit, it's okay. Let's hope and let's try to find them the right fit. Maybe if we think, hey, my colleague might be a better fit with this client than I am, say, you know what? If the client isn't, maybe I could probably refer you to someone. And maybe eventually when we have our own practice, say, you know what? Maybe I could refer you to somebody that is a better fit for you, that will be able to help you get to whatever it is that you're encountering at this time in your life. So it's a process, and I think it's a part of growth that we professionally and personally we need to encounter to be able to get better when we do. Yeah.
Yeah, you're right, Diego. You know, it's going to take time. It's definitely going to take time, but trust me, it's worth it. It's worth it. Once you know you're able to just let all those little things out that are bothering you in one way or another. You know, sometimes I like to relate it like that little rock or pebble that gets stuck in your shoe. You know, you try to ignore it, but you know for a fact it's there with every step you take. You know, and sometimes we're too lazy to take off our shoe and take that little pebble out, and that's how it can be sometimes. You know, you have that thought, that feeling that's just there, and it's just like with every day that goes by, it just, you know, you just can't seem to let it go. And I, like Candace said, you know, you don't have to wait for it to just blow up. It'll be something really serious. It could be something as small as that pebble, that you know, uncomfort that you feel, and you know, it can go away maybe in 3-4 sessions, maybe 2, after 2 times that you see your therapist. You're like, you know what, that feeling, that thought's not there anymore, and that's fine. You know, you did your maintenance, you know, using that reference again, and then you're ready to go ahead and continue on with your life. You know, that's fine. Or like Candace said, yeah, there are different episodes that you're going to encounter different people, and you might need help for those different experiences or episodes in your life, or different chapters, which I like to use with a lot of my clients as well, that analogy of the book. You know, there's so much in our life story that's still not written, you know, so we can't foresee what's there. But just know that, you know, there are people like us and Casa de la Familia that are here to help you in whatever way we can, or whatever way you need us to be. You know, and like Diego said, if we can't help you and we don't have the answers, trust me, we'll direct you in the right direction to give you those answers and give you that help. You know, we're not afraid to say, I don't know, you know, but we're not going to leave you alone. We're not going to abandon you. You know, we're here to definitely help. And that's why, you know, thankfully we have people like Jennifer here and Jessica, you know, for that additional support, even as clinicians. You know, we do need it as well. You know, sometimes there are answers that we, you know, we don't know. We don't have them to those questions you may ask. And thankfully they're here to help us, or just like my colleagues here too. You know, when we get stuck in something, some little place, some little area, we ask for that help. So even us, I think in this field, we don't have the answers. We do need help, and we feel comfortable, I think, to ask for that help. So we definitely encourage everyone out there, you know, to ask for help whenever you need it. You know, even if it's not mental health wise, rely on your family, rely on your friends as well, and they might point you in our direction or in a different direction. You know, the important thing is get the help when you need it, and don't be afraid to ask for it or recognize that you need it. I think that's important as well.
Something real quick that I just wanted to share, you know, in the Black community, very similar to what Tiffany said, it is ingrained in us from birth almost. What happens in this house stays in this house. You are not to go out and talk to anyone about what's going on, because what Candace shared, if you say anything, CPS is going to get called. They're going to call DCFS and you're going to get taken away. That is ingrained in, you know, the young children in my community from a very early age. And so we have this very negative connotation about any social services, whether it is, you know, DCFS, therapy services, a psychologist, any medications. anything related to supportive services, it has a very negative connotation for us. And then to compound that with the religious undertone that also runs in my community, if you are, hearing voices, that's of the devil. If you're having depression, that's of the devil. That's an evil spirit. So we have to kind of counteract that as well. And so I think just continuing that conversation of, like Candace was saying, it doesn't have to be a very traumatic situation that causes you to reach out and ask for help. It can be the loss of someone, the loss of your job. It can be, you separating from your long-term partner. It doesn't always have to be a very drastic situation or the catalyst for you to reach out and look for that support. I do think that the shift is happening, and there are a lot more people being open to the idea of therapy. I think I always try to find the silver lining. And I do think with all of this COVID stuff that's happening and people moving more remote and online, there has been more avenues for that, because a lot of people that didn't have the transportation to get to, certain clinics, didn't have necessarily the money to, pay for therapy. They're able to utilize it in other ways now that there have been more online avenues that have been open. So I've been grateful for that. But there is a long, continuous conversation that needs to happen regarding changing that stigma and helping people to understand that it's okay. You're not crazy if you need, therapy. And even changing the stigma of within my own family. When I told them I was going to school to get a master's in social work, they were like, "Why do you want to take people's kids away?" That's not all that we do. That is a small factor of it. But there's so many other things that we can provide, support for having this, this degree. And so again, just multiple conversations that need to continue to happen to change that stigma of what this actually looks like in our community and why it is helpful.
Absolutely. Thank you, each of you. I think you just brought such important perspectives to this. And I just appreciate you each being honest too about your own experiences. As a therapist, I think it's so important that that we have the opportunity, I would say, to like sit on the other side, right? Like we're usually sitting in the chair and we're usually listening to everything. And that I think each of you kind of touched on what it's like to sit on the couch and what it's like to be the client and experience that. And I think it just deepens who you are as a therapist. Absolutely. And your, ability to have a deeper empathy for when you're working with your individual clients. I know for myself as well. And I think something that's super important that, quite a few of you brought up, but is that not every therapist is going to be a fit for every client. And that I think that also sometimes gets in the way, is that you finally take that step where you're like, okay, I'm going to go and get therapy. I'm going to go and do this, which is such a huge step. And then you get in there and maybe that person isn't right for you. Maybe that's not the right therapist for you. And I just, I think it's so important to just keep that in mind, that there are other therapists. And it's okay if that therapist is not a good fit for you. Have that conversation. Discuss that. There's so many different treatment modalities. There's so many different ways you can go about it. There's so many different therapists out there that there is someone right for everyone, but not everyone is going to be right for everyone. So taking that into consideration, don't get discouraged if you go out and you try a therapist or you try something and it's not for you. That's okay. Look for someone else. I know for me personally, I've gone through quite a few therapists, finding someone that, and in different points of my life as well. I think we've kind of touched on that too, is that when different things have happened or different situations, different therapists, but also because they just haven't all been the right fit for me. And being able to recognize that and saying like, you know what, I think I need somebody else. I think this isn't quite the right fit. And someone did share that they're like, when you do find that it's just so different. Like, and then you just know it and it works and it fits. And kind of, I know we've all kind of gone back to Diego's analogy, but like being able to leave those rocks, right? Like leave them with your therapist. Okay. They have a huge closet for them. Leave them there. Okay. Find a therapist that you can go and unload that backpack of rocks with. But guys, just thank you so much. I appreciate each of your perspectives and all that you've shared today. And I just want to thank everyone for joining us today for our Roundtable Therapy for Mental Health Awareness Month. If you are considering seeking mental health services, please do give us a call at Casa de la Familia. Our number is 877-611-2272. You can speak to a case manager who can tell you a little bit more about our services that we offer here at Casa de la Familia and what therapy might be like for you. So we absolutely are here to support you and help you on your journey. And just thank you again. And we look forward to seeing you next month. Take care.